This video is about central line insertion, and there is one particular mistake or blunder, I would rather say, which is very dangerous to the patient, and that is the leftover Seldinger wire in the body. Okay, this is the Seldinger wire, right? This is kept inside the introducer. Okay, it's a flexible wire which is like a mini spring, and it is kept in this introducer. So many clinicians, they would like to use a cannula to insert the wire into the vein, and other clinicians, they would like just a simple needle, right? So let's say this is the body and this is the central vein. Okay, so let's introduce the needle first. Okay, let's say we are in the vein and we have a gush of venous blood. Okay, and let's say we suck out the venous blood and we confirm that it is a venous blood without any pulsation, etc. It's not bright red arterial blood. Okay, after that, if we are using a syringe which has got a hole inside, so we can introduce the wire through the hole into the syringe and into the central vein. Okay, let's introduce this. You can see as soon as the wire enters inside the central vein, it assumes the curved position. Okay, and once we are confirmed that it's inside the central vein, we can remove the introducer. Okay, and after that we will now remove the needle. Okay, let's remove the needle. So we leave the wire in the vein, central vein, and we remove the needle completely. Okay, at that stage you of course would like to make a little nick in the skin to introduce the central line easily. Okay, and after you make a little nick, of course you can go by with the dilators. Okay, these are the dilators. Okay, you introduce the dilator. Okay, and the dilator, make sure there is enough space for the insertion of the central line, which is a soft structure. Central line is softer compared to the dilators. There are two types of dilators. You can use one after the other. Okay, the whole point of this video is the step in the central line insertion, which is responsible for the leftover wire in the body. Okay, and now coming the step. So now we have got the wire inside the central vein, and now we have dilated and we have this central line. Okay, let's introduce the central line. A lot of doctors who are inserting the central line at this step, they come close to the skin. Okay, so they have inserted the central line over the wire and they have come close to the skin and they are touching the skin now. That's where the mistake starts. They should not have come closer to the skin. So they should have left at least a 3 to 4 centimeter gap between the skin and the central line. Okay, this gap is used to pump the central line, the Seldinger wire, to pump the Seldinger wire back through the central line so that you can hold the end. If you come close to the skin, you will not find a gap to pump backward the Seldinger wire so that you can hold it in the end, which is very important step. So once you get hold of the other end of the wire between your two fingers, then you can insert the whole central line into the vein. And now it will make sure that you have the wire in your other hand. Okay, once it is done, of course, if you have done the priming with saline before, with heparinized saline, then it is time to really start removing the wire. Okay, before you remove the wire, you can, some people would like to secure it with the skin at this stage, so you can just secure it, okay, using the holes. These are the two clips, okay, and then you gradually remove the wire. So basically, after the successful insertion of the Seldinger wire, when you thread over the central line over the wire and you come close to the skin and you do not leave a gap to push the wire back to the other end, you have a chance of leaving the Seldinger wire in the body, which is very important. So remember, once again, you bring the central line close to the skin, but don't touch it. Leave a 3 to 4 centimeter gap so that you can pump the Seldinger wire backward into the other end of the central line, and you can hold the wire there, and then you can insert the central line into the vein. By doing this, you will eliminate the chances of leaving the Seldinger wire in the body, which is a blunder and a very serious mistake. Thank you very much.